Thank you very much. Yes, I do officiate NCAA football. Some folks ask if I ever carry my flag around. The answer is no. I will be actually taking off a little bit later this afternoon. I'm doing a game up in Oregon on Saturday, so I have to fly up there. And so I know that I have the coveted immediately before lunch spot here, so I will try to make this a little bit quick. But a lot of data that I'm going to show you here today from an upcoming study that I'm publishing actually on November 5th. So for the first time ever, we're going to publish a telehealth satisfaction report at J.D. Power. We're going to be giving 2 J.D. Power awards in 2 different segments, one for direct-to-consumer and another one for the payer segment. I attempted to do a segment for health systems, but however, it's for a different conversation, but incidence was extremely low for the health systems, and we couldn't really find a statistically valid sample size, but we'll end up actually publishing a health systems benchmark on November 5th as well. So I reached out to tens of thousands of health consumers, kind of a blind study ultimately, and said, did you use telehealth or have you used telehealth within the last 12 months? And as I was designing the study, I thought to myself, well, if incidence is going to be so low, why don't I also ask non-users why? And what characteristics essentially would increase your likelihood to try telehealth here in the future? So the following findings will be published with significantly more detail on November 5th. Actually, for anyone attending the Health Digitalization Conference in Las Vegas, the end of October here, we'll actually be announcing the award winners on stage at the American Telemedicine Association pavilion there. So non-user N is about 3,200. Right now, first and foremost, we ask, is telehealth or virtual health an option available to you? Only 33% of respondents said yes, with 29% saying no, and another 37% saying that they don't know if telehealth is an option to them. Of those that have used telehealth within the past 12 months, you see the various cohorts down there at the bottom. Males have used telehealth more than females, but only about 9.6% of health consumers at this point. The good news is there's nowhere to go but up. The other piece of good news is that, and this is actually based off of another study that we do at J.D. Power, our commercial member health plan study. So this data was published a little bit earlier this year. But 48% of health consumers did say that they would consider using telehealth if it was offered. Of that 48%, this study showed that 7% of those respondents actually used telehealth. But of that 7%, 87% said I definitely will reuse the service again here in the future. And then that graph there on the right-hand side, we measure satisfaction on a 1,000-point scale at J.D. Power. If I use telehealth as a part of my health plan or health system, I am significantly more satisfied than if I did not use telehealth as an option there. So another piece of good news. So getting back to non-user awareness, of those that indicated no or don't know, males have the highest awareness at 41%, as well as urban, and then Gen Y at 46%. However, a little bit surprising and maybe not the best piece of news, but rural respondents, only 25% reported that they actually knew that telehealth was available to them there. So what are those usages and barriers? I've heard a lot of people talk about kind of those usages and or a lot of kind of hypotheses and everything. Hopefully I'm able to now quantify them for you. 31% of respondents just simply said, I wanted to see someone. They're social, they're lonely, and or just wanted to go say hi to somebody that day. However, another 31%, everything really highlighted in green here, is something that I believe that people in this room in the industry can control. 31% just were unaware that telehealth was an option. 16%, that increases to 43% among Gen Z respondents, just unaware of telehealth as an option. 16% wanted the care tied to the current doctor or provider. That increases to 34% among boomers. That's just simply, EMR integration there. 13% said that when I needed care, telemedicine didn't come to mind. 11% are concerned about the quality of care. Another 11% didn't understand the process. 7%, there's some security concerns, 6% too complicated to use, but only 6% of respondents said it was because of the cost of telehealth. So we also asked, what would increase your likelihood to try telehealth here in the future? We first asked it as a multiple response question. Please select all the things that would increase your likelihood to try telehealth. And that's that light yellow bar there. The orange bar is after they selected everything, we asked them what is the most important reason for you or characteristic for you to try telehealth. 28% wanted to say that their insurance covers the visit. 15% said low cost. 14% said your medical needs or conditions can be serviced by telehealth visits. 10% said I trust the provider. Another 13% combined said highly rated doctors or good patient reviews. Wherever the doctor.com people are here in the room, I'd love to speak with you at lunch. We can strategize a little bit on that. And then finally, we said, what would also increase the likelihood, or in the next 12 months, how likely are you to try telehealth? Only 8% of the population said under no circumstance would I ever consider trying telehealth. 25% said I definitely would consider trying telehealth. However, that increases to 33% if the cost of the telehealth visit or service was less than the visit or the cost of a doctor's office copay. That also increases to 29%. I just heard my friend over there talk about this. If you offer a demonstration of the service and the platform, that increases to 29% definitely will use, with 51% saying that I probably will use it if a demonstration is offered there. So I know I actually practiced this a couple of times and even did a Toastmasters event last week at my office. It was running around 10 minutes. There's a lot of really good information in here. It is going to be released and published, I think, later this week on a couple of websites. Please, if you have any hypotheses or anything, we're going to continue doing this research even after November. Please feel free to reach out to me. I'll leave my email address up there kind of at the end, but just kind of in closing thoughts for everybody here in this room and talking points to take away with you. I mean, what would a 5%, 10%, 20, 30% reduction in emergency room visits and urgent care visits do for your plan or for your health system? Only 8% just said that they were not interested in ever using telehealth. However, 72% would try the service if their cost was less than a doctor's office visit. 80% would try it if a demonstration was offered of the service. Those adoption marketing message need to include things like lower cost or cost-efficient language, as well as an option on how to, or a demonstration on how to view the service. And the main takeaway here is that telehealth users, are more satisfied with their health plans than non-users, and 80% or 87% of those definitely will reuse the service again. So with that, I will take any questions or be the last one in line for lunch here. There's my email address down at the bottom.
Hi, I just have one simple question. Did anyone say that their internet connection wasn't strong enough?
You know, that's actually one thing that we included in the user, and I did not have that information because my team is very hard at work crunching it right now. Actually, because there's a couple of individuals in this room that are going to be ranked up there. I can't really show any of the user information, but yes, that is something that we did test, absolutely.
I've heard reports that various providers are not interested in telehealth because they get a lot of questions that somebody would not have otherwise used the service for. In other words, it increases utilization instead of decreasing. Do you have any questions that address that?
So that'll actually come out also, I do apologize, in the user report. So we did ask, was your ailment, or were they able to address your ailment based off of the telehealth service? That was kind of in the user side of it here. These were all folks that just have never used telehealth in the past. So that information will be published as well on November 5th. But yes, something that we did consider and look into.
Hi. So I always thought of telemedicine as having its advantage being convenience. You don't have to go to the doctor. You don't have to be in the waiting room. You don't have to get sneezed on. You don't have to spend 4 hours. But what I saw you put up there was that around 70-some% would consider going if the cost was less than the copay for their office visit, which says to me that convenience isn't an issue. This is all cost-driven. That the bottom line is if you can beat or match the price, you'll get the business. They don't care if they have to go and wait 4 hours in the waiting room. It's all about the dollar. What do you think about that?
I think it'll be interesting when I start to break this down by cohort. Part of my white paper that I'm working on right now, I actually interviewed a millennial female that's living in an urban environment, and the title of my white paper is "Why Don't More People Know About This?" So I think it's just generational, and it's going to depend on cohort, that particular, because again, 31% of respondents just said, I want to see someone in person. Not that I had to see someone in person, it's that I wanted to see someone in person. Oh, yes, ma'am?
So what I'm hearing and what I've heard these last 2 days is that telehealth is the future of, it's the transformational kingpin of tomorrow. I don't believe it's possible unless internet access is universal and so low cost that no one is left out. How do we do that?
So interestingly, in my study, I am asking everyone who their wireless provider is. I'm asking them who their wireline provider is. I'm asking them what kind of device they use, handheld, laptop, tablet, et cetera. We have a pretty robust telecommunications practice, and I'm going to share that information with my counterpart. Going to actually share the stage at that ATA pavilion with the president of Verizon's health kind of area. We're going to publish that information. It's probably going to be one of my key findings on November 5th when that publishes. One point that I did not make that I wanted to bring up as well is that in doing some research on this latest white paper, I'm really kind of equating telehealth and telemedicine right now to mobile banking. I mentioned it in a white paper that I just published in July as well. And an interesting finding that I came across was that in 2002, Wells Fargo was one of the first national institutions to introduce mobile banking to its consumers. I mean, they've got millions of customers. This was before all the negative stuff. They had millions of customers. But in 2002, 2,500 of their customers signed up for it when they went to market with it. And they immediately closed it later that year because of a lack of adoption. Now, when's the last time any of us have gone into a bank? Versus how many of us have taken a picture of one of our checks, if we still do get checks, and mobile deposited it that way. So that's the way that we're looking at it at J.D. Power in terms of adoption. No one wanted to use their phone to do any banking 10 years ago.
That's not really what I'm talking about. I'm talking about the person in Timbuktu, town of 300, that they have very poor internet connections, and wireless cost is beyond them, and they're just this lost. And they very much, rural healthcare could be very much served by telemedicine and telehealth.
Sure, and I think it's about those health systems that are in those areas, partnering with different telecommunications providers. I think it's about groups like J.D. Power, disrupting the industry a little bit and actually publishing that information and putting pressure, on those telecommunication providers to provide better access at a cheaper cost. I remember working with VA 6, 7, 8 years ago when I ran our government practice in DC, and them actually driving veterans from rural areas to one of their outpatient medical clinics to then have a telemedicine interaction with a VA doctor somewhere across the country because that veteran didn't have access, to care at all. So I think it's going to be a combined effort, and I think we're going to see it, though. However, I really do. 10 years from, or maybe hopefully not 10 years from now, but within 10 years.
Just a quick comment on that. Our company is the largest provider of behavioral telehealth to small facilities in rural America, and 5 years ago, maybe we'd see, and these are small, this is the towns of 500 and 800, Muleshoe, Texas, and Sleepy Eye, Minnesota, and places you wouldn't even know if you're there. when you're there. So maybe 5, 6 years ago, once in a great while, we'd find somebody that didn't get internet, good enough to do good quality telehealth. I think it's been several years since we've run into that. Now, we don't do much in the home, and occasionally that is an issue, and they have to go to a doctor's office, but it's not really the problem that it's kind of been made out to be in a practical way. And we're probably in 400 little towns across America in 22 states. And by the way, this is just wonderful work that you're doing. Oh, it's great.
Thank you.
Great. Thank you so much.
Obviously a gap in the marketplace if there's a startup out here or some funding, right? Yeah. Thank you very much. Enjoy lunch, everybody. Appreciate it. Yeah.
Thank you so much.